Hi, my name is Dr. Brad Perez from Back to Healthcare in Redondo Beach, California. We're going to talk about disc bulges today and disc herniations and how to get rid of them the natural way. First of all, the disc. The disc is part of the spine. This is the spine from the side, so if you're standing like this is what it would look like. The spine itself has discs that are in between the bones, and they act like cushions. That's really all they are, and they protect what's inside. Inside the spine you have what are called nerve roots. The only way you get pain is you put pressure directly on top of nerves. So when you squish down on one of these nerves, you're going to get pain. The disc can get squished by the bones in this fashion. If somebody has too much of an arch in their back, the disc can squish out and hit a nerve. The bone and the disc can hit the nerve at the same time, or the disc itself. Most people that have disc injuries are either compressing too hard this way, or their back is like this, and they have bad posture, and they're squeezing the bones are squeezing the disc together. The discs are like these jelly-filled cartilage that sits between the bones, and when they hit that nerve, they can cause pain. Now, there are ways of taking this problem and fixing it. A lot of surgeons like to cut the disc out and fuse the bones together. What we like to do is we like to decompress the bones and take the pressure naturally off the area. When you decompress the bones, the disc comes back into place and takes pressure off the nerve, and the patient feels better. The ultimate goal is getting the patient in better posture. If they're too straight, we get them into this posture right here where they have a curve to their back. If they're too curved, we actually work on their posture and get them back into more of a straighter position, decompressing the nerve. There are many ways to decompress the nerve. We do use a decompression table that actually takes the pelvis and decompresses the nerve in this kind of motion, just like this. Okay? When a good chiropractor is actually working on the spine, he can take the pressure off the nerve very quickly. A good physical therapist can do it as well. There are medications that patients use to actually take the inflammation away from the nerve, but it never physically decompresses the nerve. For more information on disc herniations, check out Back to Healthcare, all one word, .com, and we have a whole section on literature and studies on disc herniations and disc bulges. Our phone number is 310-371-3134. My name is Dr. Brad Perez. Thank you for the time.